Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Thursday, February the 11th, 2021. I just want to say that I will have media availability after this to address any political or election issues. Given the seriousness of where we are right now, I feel that today's briefing has to be all about public health and safety. I understand there's concerns about the election, and we will answer those questions afterwards. But right now, people need to hear from Dr. Fitzgerald and her team. So with that, I'll pass it over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everybody. Thanks for joining us today. Since the media briefing yesterday, we have 100 new cases of COVID-19 in our province and one presumptive case. Of the confirmed cases, we have one in Western Health between the ages of 60 and 69, and the remainder are in Eastern Health. The breakdown by age is as follows: 74 under 20, 10 between 20 and 39, 4 between 40 and 49, 6 between 50 and 59, 1 between 60 and 69, and 4 over 70. The total number of cases in our province is now 610, and there have been no new recoveries since yesterday, leaving 210 active cases in the province. 1,667 people have been tested since yesterday for a total of 85,887. I want to start by thanking Eastern Health staff working at our testing sites today in St. John's and Mount Pearl in the midst of a very blustery snowstorm. These are the individuals performing the COVID swabs at the outdoor drive-through sites at the Janeway, the Waterford Hospital, and Mount Pearl Senior High. We continue to see record positive cases reported by the Public Health Laboratory. It is evident that COVID has been circulating undetected in our province for some time. This tells us that the majority of cases had mild symptoms or were asymptomatic and did not come forward for testing. We are now seeing a snowball effect as a result of exposure notification and contact tracing. For most people in our province, positive COVID cases were just a daily statistic. Now they are real and present. They are your family, friends, and co-workers. There are two key strategies to contain the outbreak in this region and preventing spread. One, widespread testing. It is essential to find the cases, identify their contacts, and isolate them. And number two, adherence to the special measures orders and public health guidance. Whether you are a business or family, you must follow all public health recommendations and directives to protect yourself, your family, and your community. Public health cannot fix this alone. These measures require action on your part. We can only overcome this if we do what needs to be done together. Regional health authorities are also increasing restrictions to protect residents of long-term care homes. And these residents are our most vulnerable population with respect to COVID. Visitors will be reduced and additional precautions will be implemented while ensuring that residents have the necessary care and support to maintain quality of life. Due to the rapidly evolving nature of the public health investigation in the metro area and ongoing detection of new cases among students in grades 7 to 12 and their contacts, Public Health is advising anyone who participated in the following events below on the specified dates and times listed below to self-isolate for 17 days. As well, if any of the individuals who have been advised to self-isolate develop any symptoms of COVID-19, they are advised to arrange testing. Students in grades 7 to 12 and other individuals who attended parties or gatherings of 10 people or more with these students in the metro area between February 5th to the 7th. So that's from February the 5th to the 7th. Students in grades 7 to 12 and other individuals who played team sports with students in the metro area from February the 5th to the 7th. This includes individuals who live outside the metro area who played on the same team or opposing teams or played in a tournament. Individuals who coach or assisted the team or assisted team sports in grades 7 to 12 who played games or practiced in the metro area from February the 5th to the 7th. Individuals in the above groups are asked to self-isolate away from household members for 14 days from the date of the last gathering or game they played, or from their last contact with a positive case, whichever is more recent. If a self-isolating individual who attended one of these events develops any of the symptoms of COVID-19, they should arrange testing. People can arrange testing by completing the online self-assessment and referral tool, or they can call 811 if they do not have access to a computer to get referred for an appointment. Your patience is appreciated, as you may encounter a delay in receiving a call to arrange your test due to the volume of testing appointments being requested at this time. All those who get tested must continue to self-isolate regardless of whether they receive a negative test. Household members of individuals affected by these advisories are not required to isolate unless they or their household member is experiencing symptoms of COVID-19 or test positive for COVID-19. Any Eastern Health staff that are impacted should contact their occupational health and safety line for further instructions. Through our testing, we are seeing many positive cases who are asymptomatic or who have only mild symptoms. Because of this, we are amending our testing criteria. If you have only one symptom, even if mild, you must get tested. The symptom list is fever, including chills and sweats, a new or worsening cough, shortness of breath or difficulty breathing, runny, stuffy, or congested nose that is not related to seasonal allergies or other known causes or conditions, sore throat or difficulty swallowing, headache, acute loss of sense of smell or taste, unusual fatigue or lack of energy, new onset of muscle aches, loss of appetite, vomiting or diarrhea for more than 24 hours, and small red or purple spots on the hands or feet. We have a high volume of requests for COVID tests. And this is a good thing, but it also means more demand on testing resources. Eastern Health is working to increase testing capacity, and we are prioritizing those who are contacts of cases. If you are not a contact of a case and have one symptom, it will take a little longer to get an appointment for your test. Please have patience and self-isolate. When requesting a test, please use the online assessment and referral tool. This is by far the fastest and most efficient way to book a test. As you can imagine, there are many concerned individuals calling 811 right now, and the wait to speak with a nurse through the health line may take a little longer than usual. If COVID was able to circulate within the metro region without detection, I have concerns that it could very well be happening outside of the St. John's metro area. We are therefore asking anyone in the province with one symptom to book an appointment for testing using the online assessment and referral tool. Please isolate until you have received a negative test and your symptoms have resolved. Do not make the mistake of thinking COVID is contained to Mount Pearl. We are finding cases across the metro area. Leaving Mount Pearl to buy groceries in St. John's or another community will not reduce your risk and, in fact, may possibly contribute to spread. It is crucial that you are diligent in protecting yourself and others when shopping for essentials. Wear a non-medical mask with at least 2 layers. 3 layers are better. Make sure the mask covers your nose and chin and has no gaps. A face shield is not acceptable. Do not pull the mask down to be heard. Sanitize your hands upon entering and leaving the store. Stay 6 feet away from others. Remember that your mask does not replace physical distancing. Respect the directional arrows and avoid crowded areas of the store. If you are outside the metro area, we strongly caution you to avoid travel into the region at this time. Please only travel into the metro area if you have an essential reason such as work or a medical appointment. If you can delay your travel, please do so. As a recap, for those who may have just joined, we have 100 new confirmed cases since yesterday's media advisory. The total number of cases in the province is 610. I know the position in which we currently find ourselves is disheartening, and it is normal to feel scared. I also know that we have learned a lot about COVID-19 in the last year, and what we must do to keep one another safe. It will take our collective efforts, but we are resilient, we are strong, and together we will get through this. So hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie for a few brief comments.
Thank you very much, Premier. Day 341, and we've passed yet another landmark. I just want to re-emphasize some of Dr. Fitzgerald's comments about testing and symptoms. It is obvious that a significant number of people have had mild symptoms. It is the time of the year for runny noses and tickly cough. And the tendency to minimize these has always existed. And I think Dr. Fitzgerald's message is very clear that we should not do that. A case reported, a case tested is a case contained. And that's what we need to do at this stage. We've done it before. Other jurisdictions have done it. And we can do that too. The mildness of the symptoms is typical of youth. And it's important that we encourage them to get tested. It's not down to finding blame. We've encouraged team and sport activities for some time as part of a wellness strategy and a wellness approach. And as for social gatherings, well, teens do today what we all did when we were teenagers too. And we all think at that age we're going to live forever. So encourage them, support them, and don't blame them. It's our job as mature members of society to encourage these individuals to feel they are able to step forward without stigmatization. And there's one criteria now off those lists instead of multiple. I'd just like to conclude by saying that this problem is fixable. You can fix it, we fix it, but we do it together. And I would repeat Dr. Fitzgerald's adage of hold fast, Newfoundland and Labrador, but I'd add to that, get tested. Thank you, Premier.
Thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 9 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I'll ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering if you can elaborate a little bit on the requirement for young people who are at sports or other gatherings to isolate. First of all, why that specific grade range when sometimes there may be people just outside that that may have interacted? And can you just explain why this was necessary?
So through the investigation, the public health officials in Eastern Health have certainly found that there's quite a number of common source events that happened over the weekend of February 5th to the 7th. So there was a lot of sporting events. There were some parties and things like that that happened over that weekend that seemed to be when the spread started to really take off. So in order, contact tracing takes time. It takes time to find these people with testing. And so the concern is that, from the 5th to the 7th, some of those people would just be starting to become symptomatic and infectious at this point, potentially. If we can take those people out of circulation of the virus, so to speak, that we would be able to certainly slow the transmission of the virus from those groups. So it really has to do with what we've been seeing with regard to transmission patterns, and certainly we are seeing, for the most part, that the people who are positive, as you can tell from the numbers that I read out today, the majority of them are teenagers in those grades. There are some people who are slightly older who may have attended some of these events as well, and that's why we've said other individuals who have attended events with these students that they should isolate as well. But by and large, we're seeing the transmission through the student population and into their families.
There was a long list of businesses that was put out yesterday that you're asking people if they attended on specific dates and times to come forward with testing. I've heard from some people that they're pretty low on the queue, so some of them haven't even gotten a call back yet to get a test booked, and then might likely be another few days. So people in that situation are wondering, should they be isolating until that, even if they don't have any significant symptoms and they're not aware of any contact at that business with someone who is now tested positive?
So if they were there at the times that are listed on the advisories, then they can be considered to have had an exposure, and so yes, they should isolate.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Now that so many cases are coming, I guess, to light here, and we've seen the restrictions put in place, what impact is this having on the hospitals right now and appointments that may be booked?
That's a good question, Kellyanne. We do have a number of healthcare workers isolating. Eastern Health currently reports 155. I'm advised by Mr. Diamond that there is maybe a potential for some reduction in ambulatory care services, but no firm decision has been made there as yet. With regard to inpatient services, planned and emergent, they are continuing unchanged for the moment, but the situation is being assessed on a daily basis for sure.
Thank you. And we know that there is quite a few schools impacted by this in the St. John's Metro region. How many schools outside of the St. John's Metro region are we expecting this to have impacted, knowing that a lot of these sports teams, like you've mentioned previously on this briefing, will have been from outside of the Metro? Those students will have gone to school this week.
So the majority of the schools affected are in the Metro region. With regard to this advisory now, how many will be affected, I'm not sure that anybody really knows that at this point, which is why we're making this advisory, so that we can make sure that those people are isolating and if they have been exposed, are not transmitting the virus any further.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I'm wondering about our contact tracing capacity. Do we still have capacity there? Are we getting close to the edge? How is that going?
We certainly have contact tracing capacity. There's a lot. I won't say that it's not challenging at this point, but we have been able to draw on people in other areas of the province to expertise in the other regional health authorities, as well as contact tracers expertise in our environmental health officers, and we've also had arrangements with the federal government to be able to avail of contact tracing that way. So we certainly have the capability to increase our contact tracing capacity even further.
Okay, thank you.
Do you have a follow-up, Sarah?
Should we expect changes for rotational workers?
To their isolation?
Yeah.
At this time, no, we're holding where we are. I mean, obviously, we're considering all kinds of strategies at this point, and we're certainly looking at that. This outbreak is certainly taking a lot of our time right now, but as time goes on, those are things we will have to look at.
Okay, thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Good afternoon. We're told by some educators that the school district is planning for in-class instruction specifically with students with complex needs. And they're telling us that they still have no guidance from the CMLH yet regarding that. Are you aware of this? And is there a plan to deal with in-class instruction for people with complex needs?
So with regard to, I believe there was always in the plan a contingency to look after children or to have children with complex needs who weren't able to participate in online learning to be in school and to receive their education that way. This has happened in other jurisdictions. It's not new to us or unique to us. So certainly I'm aware that that is a policy with the education return to school plan. With regard to public health advice on how to do that, of course, the advice would be, as it always has been, with these personal public health measures as to how to reduce your risk. So I'm not sure that there's a whole lot more to offer than that.
Okay, yeah, they were just concerned about the vulnerability of those kids and the risk to the staff. Still with schools, can you update us on the situation with Chromebooks? We're hearing from a lot of schools that are saying, one school specifically said there's an issue with global supply chain, and others have said they don't have near the number. Some schools with 600 kids and only 70 or 60 Chromebooks. And how will that continue? Is there any word on that supply?
Well, certainly, Brian, my understanding was from the school district and chatting with Minister Osborne that they were working very hard to resolve any issues with Chromebooks, and that we should be well positioned within the next few days to ensure that, based on a needs assessment, that anyone who does need one will get one. And they've been redirected from distributing elsewhere around the province to the metro region. With respect to individuals or exact numbers, I'd have to get those from Minister Osborne.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Good afternoon. I just want clarification on presumptive cases. We had several of them yesterday. Can we assume that those are all now confirmed, or are they rolled into today's confirmed numbers? I'm not sure how that works.
Yes. So if they became confirmed, they would be included in today's confirmed numbers. And my understanding is that most of them, if not all of them, were confirmed positive.
Oh, okay. So just as a part B to that, so the 100 confirmed cases today actually include all of the presumptive from yesterday.
They would include those presumptives from yesterday that were confirmed to be positive, yes.
Okay. I just think I get a second question here, and that is, I'm wondering what you say about government managers who are insisting employees working from home have their children in daycare or have made similar arrangements. These are workers who need to go home to work.
My understanding is that the clerk of the civil service is working with all the deputies right now to ensure appropriate work from home plans are in place and individual circumstances are met.
Okay, thank you.
Our next questions are from Elizabeth Witt with All Newfoundland and Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, I'm looking for an update on approximately how many people are currently self-isolating.
It's inappropriate to say all of them, right? I mean, it's more than yesterday, which was 1,500, and but I don't know the exact number.
But it must be significantly more, though.
Yeah, there's just so many we're not keeping track at this point. Like you get to a certain point where it's 1,500 or it's 2,000. I really couldn't have that number for you. Sorry.
Thank you. And now that we have 210 active cases, and it's only expected to grow, are we looking? Are these daily Monday to Friday COVID briefings? Are we going back to that?
I mean, I think we'll be doing daily briefings that, I'll be having daily updates for the foreseeable future.
As long as it's necessary.
Yeah, as long as it's necessary. Whether we do weekends, I'm not sure. That's, I probably shouldn't be answering that question. I'm sorry.
Oh, no, it's yours to answer.
Oh, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. I'm wondering about long-term care and senior homes. Are there new rules regarding those establishments and people having access to them?
Yes, so in our special measures orders of 2 days ago, hard to remember now, the first special measures orders that we put out with this outbreak, we did actually have a significant number of changes for long-term care, personal care homes and assisted living facilities in the metro area. And they're all available online.
I guess I'm just asking because we know how vulnerable they've been in other provinces when something like this has happened. Are there further measures being taken? Are we going into a sort of a lockdown situation for seniors living?
So we certainly, after our last, we'll say lockdown, we heard, quite a number of concerns about the health and well-being and mental health of seniors in congregate living facilities. We did some consultations with seniors, with residents' families, with owners of personal care homes, and we came to. We developed a document as a result of, and in conjunction there that we looked at that could be fluid, that we could have, during times of low prevalence, we could have what we've been having all along with the 6 visitors and all of that, and then as community transmission increased, that we would be able to increase measures. So we are using that document. We are implementing the measures that we identified, but we did recognize that shutting down visitation completely was very hard on a lot of seniors, a lot of residents in these facilities. So we're trying as best we can to balance decreasing the risk with maintaining their health and well-being. So these measures, I think, reflect that. If there's an outbreak in a home, of course, that's a different situation, and in that case, then we are stricter again.
Thank you.
Our next question from Roger Bill with iPolitics. Please go ahead.
Dr. Fitzgerald, yesterday you said you were going to be meeting with Mr. Chalk to discuss the community spread and the upcoming election. Can you tell us about the conversations and what decisions were reached?
So we had advised of what would need to happen for an election to happen safely, which is what we're asked to do. That's what public health does. They provide advice as to, how things can happen safely, and I'm not sure what else there is to say there.
Yesterday I asked you about, the question was brought up earlier, I asked you about the ultimate authority to make a decision. You said your view was that you didn't have the authority to do that, but has there been any review of that idea? Is that still your view?
We've had a legal opinion on that, and it is that I do not have the authority to shut down an election.
Thank you.
Our next questions are from Ross Lord with Global News. Please go ahead.
Okay, Dr. Fitzgerald, thank you for that, which leads to my question about, from what you see of the, if I can call it, partial postponement of Saturday's election, how do you figure those measures stand to protect people from this COVID outbreak accelerating even further?
So I don't even know.
We're going to have questions about the election afterwards, but specifically with respect to mail-ins and postponement, is that with respect to epidemiological spread?
I guess what I'm after is, as the chief medical officer, how did those measures, included in the partial postponement, make sure that the outbreak doesn't get worse?
Well, obviously, if people are able to stay at home, obviously that's the best option. If that's not the option you have, then you find ways to do it safely so that the risk is low. So that's where we are.
Okay. My follow-up, how much of the electoral officer's decision to postpone or partially postpone was based on input that you gave. Did he come to you with a plan and you said, this sounds good? Or did you give him input which may have caused him to include that in his decision?
So I gave my advice, and Mr. Chalk made his decisions. I'm sure that factored into it to some degree, but I can't tell you what else factored into his decision. You're going to have to ask him.
Yes, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
There has been a lot of focus on Mount Pearl and kind of the Metro St. John's area. Are you able to give us an idea how many of the cases in the eastern region are outside the metro area?
So my understanding right now is that the majority of them are actually in the metro area. I can't give an exact breakdown at this point. You know, Eastern Health is very busy on the ground, and I'm sure they're compiling all that information, but I don't have that detailed information at this point.
There are a lot of people in isolation right now. What's being done to follow up with them to make sure they're abiding by their isolation? Dr. Fitzgerald, as the minister mentioned earlier, teens sometimes have their own opinions and their own social desires to gather.
So anyone who's in isolation because they've been identified as a case, they do get regular follow-up. They get a phone call just to make sure that everybody is playing by the rules, and but the most important thing is we want to follow up regarding symptoms to make sure they're feeling okay and that they have the supports that they need to be able to isolate successfully. So they do get regular follow-up.
Okay, thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Yesterday, you had announced that there was a case within the St. Clair's Mercy Hospital. Wondering if there's an update on that situation there, and if that employee had actually been vaccinated for the virus.
Minister, do you have details on that one?
Sorry, I had you on mute. I don't have any information about the individual's vaccine status, no.
Okay, thank you. And when it comes to 811, we know it's overloaded at this point. What efforts are there being made to add, I guess, additional resources there, or is it just directing people to the self-assessment tool online?
Both, Kellyanne. The self-assessment tool actually short-circuits 811 operator in the sense it is automatically, electronically delivered to the appropriate regional health authority public health point, and it saves a step. The company providing the 811 service has been very flexible in the past. They had scaled up, if you remember, earlier on in the evolution of the pandemic, and my understanding is that they're scaling up again. There's usually a lag time of a day or so.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. Dr. Fitzgerald, are you able to say what exactly your advice was to Mr. Chalk? Can you clarify what your advice was?
So my advice was, as it is all the time, for how to do things safely would be to, make sure that people are physically distancing, that people are wearing masks, that they don't use the same pencils, that they use hand sanitizer when they walk into the building, that the poll workers are protected with personal protective equipment. Those are the that's mainly the advice I gave, and we discussed how to safely do a poll for people who may be isolating. It appears to be moot at this point, so I'm not really sure why we're still talking about this.
Thank you.
Do you have a follow-up, Sarah?
No, that's fine. I'm sure you can understand that there's quite a lot of confusion because it hasn't been clear who exactly had the authority to make this call. So, Chalk was saying that it was yours, and you seem to be saying that it wasn't. So, if you can address the confusion, that would be great.
All I know is that I was advised that I do not have the authority to postpone an election, and what else was said is out of my control.
Okay.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. A couple of questions regarding hospitals. First of all, are there, out of all of the cases now, are there any hospitalizations?
At this point, no, I'm not aware of any hospitalizations.
Okay, thanks. And we're hearing, I'm just curious, I know there are restrictions now on long-term care visitation. That's been reduced. I'm wondering about general hospitals. So say the health sciences, I think patients are still allowed 6 visitors, one at a time, but still 6 visitors. Is that still in effect? Is that changed, or can you update us on that?
Minister, probably best directed towards you.
Yeah, certainly. There are unit-by-unit changes at St. Clair's, given the presence of a positive employee there. My understanding is that the general volume of traffic in the hospital is kept to a minimum. I'm not aware as yet that there have been any changes to visitation, but I can go back and confirm that through the Regional Health Authority.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello. If you follow the case counts over the past 3 days, they certainly seem to be logarithmic and suggested of uncontrolled spread. Is that something that causes you worry at the moment?
Thank you, Peter. That's a good question. And yes, indeed, the spread the growth that we're seeing right now, it is a reflection of spread, but it's also a reflection of us contact tracing and finding these cases as well, right? So we have to remember that. But, certainly we know that we've had this virus circulating for a while. And so because of that, we're not catching this at the very early stages where it's just starting to grow. We are seeing it probably in a more rapid growth period, and that's why it is so important right now for people to follow the special measures orders, and it is so important for people to keep their contacts as small as possible in the metro area for sure, but even across the island. This is happening here right now, but it could be anywhere across the island, and we've seen how quickly it can get out of control here. That can happen anywhere else, and we really don't want that to happen. So we're really asking people to take a really good look at the number of contacts that you have in your life, and to work from home if at all possible. We all have a lot of contacts, generally speaking, at our work. So if you can do it from home, let's reduce those contacts, because there are lots of people who can't reduce their contacts. They have to go to work. They have to be on the front lines. And so we all need to do what we need to do so that we can keep our whole community safe. We do that so that we can keep everybody safe. Our healthcare workers, our frontline retail workers in grocery stores and pharmacies, and all these people who are out there day to day doing what they need to be doing. So we really need to focus on those measures and playing by those rules. And we're going to see what 2 weeks brings, but this can get out of hand very quickly if we all don't play our part.
Thank you for that. And speaking of workplaces, we've had the same pandemic guidelines since day one in terms of hand washing, mask wearing, 2 meters apart. Do you see any point that those guidelines might even be more restrictive given the spread that we have at the moment?
I mean, certainly hand washing guidelines have been the same probably for many, many, many years. We need to make sure that we're doing that effectively. But with regard to mask wearing, certainly I think any time that you're around people who aren't in your bubble, it's always a good idea to wear a mask. And it doesn't matter if you're 6 feet together or not 6 feet together, just, it's a small thing that you can do that can help to protect those around you, but it may actually also protect you as well. So, we say definitely if you're going into indoor public places, you need to wear a mask, but think about it, people tend to get a little complacent at work, and they see the same people all the time and they think, oh, I don't have to wear my mask, but it's worth it to try to do that. Physical distancing, certainly at this point, we've always said 2 meters. I think most people are still agreeing 2 meters, even with these new variants of concern right now, we're still saying 2 meters. And outside being better than inside, good ventilation, all of that still applies to reducing the spread of COVID.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. I'm wondering, when is the next expected shipment of either the Pfizer or Moderna vaccine, and to what amount?
At this point, we expect Pfizer this week, I believe, but I'd have to get back to you about the amounts. I'm sorry, Elizabeth. Unless, Minister, you know. Sorry.
Go ahead.
Sorry, I interrupted. Can you continue?
No, I was just going to say, unless Minister had some information that I may not have had, but I'm not sure.
My understanding is there is a tray expected next week, and then thereafter at least a tray per week to the end of February. Thereafter, the amounts are from Pfizer for planning purposes only, and therefore subject to change. They have undertaken to replace, pick up, accelerate deliveries in March to compensate for the slow flow in February. That remains to be seen whether they will do that. But those are approximate. I think the figure I had this morning was that 93% of the Pfizer vaccine that we have had delivered has been administered as either a first or second dose.
Right, and that leads to my next question. I was wondering how many people have received the double dose of the vaccine and are now considered inoculated?
I would get that number for you, but from the top of my head, it's 2,300, but I can get the accurate one for you. I may misspeak, but that's the last number I vaguely recall seeing this week.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. Hearing that the federal government may be providing some help in terms of tracing, contact tracing, is that the case? And if not, has the request been made to the feds to help out in any way, given the high increase in cases?
I'm sorry, I missed part of the question, but...
The federal assistance with contact
Oh,
tracing.
yes. So we've already reached out and we have availed of some assistance already. Some people with Stats Canada are helping out in that regard. And if we need to have more, then we can do that.
And just trying to get a sense of the trajectory of what we're seeing right here. You know, is there any modeling that has been done in terms of where we're headed? Is there a sense of when we could possibly, do something like have an in-person poll or eliminate some of these restrictions?
No, we're still very early in the investigation, and at this point, everybody is very busy doing that. But certainly, the modeling group has been working diligently, but not sure if they're actually addressing that question at the moment.
Thank you.
Our next questions are from Roger Bill with iPolitics. Please go ahead.
Dr. Fitzgerald, I'm sure that in the last year you've had some days that were exhausting, that were really pressure-packed. I'm wondering how the last 24 hours compares to the worst of those days.
So there have been a lot of exhausting days over the past year. We're this is a different situation than we've been in before. It's a bit more severe, I suppose, than what we saw ourselves in last spring when we had the big outbreak at the beginning of the pandemic. But we've learned a lot since then. So I think we've got a great team here at the department. We've got a great team in Eastern Health and in all the regional health authorities. And we've all learned so much and been able to put so much in place that we're dealing with it. And it's always stressful trying to make sure that we're doing what's right and what's the best evidence and trying to stay on top of things. So, but we're all getting through and depending on each other and working together. So that's the most important thing.
Premier Furey, this morning, political science professor Kelly Blue at Memorial University did an interview with CBC Radio, and his view is that it's absolutely inappropriate for you to be chairing these briefings. I'm curious, the briefing that's going to follow to discuss the by-election, or I'm sorry, the by-election, but the provincial election. In what role will you be chairing that? Will you be chairing that as the premier, or will you be chairing it as the leader of one of the parties and the candidate? And if you're going to do that, are the other leaders of the NDP and the PC going to be there? Or how are you going to thread this needle?
Yeah, sure. As I said in previous answers, my role here is operational and supporting Dr. Fitzgerald and as premier in caretaker mode. The media availability after will be completely separate, no different than other candidates are doing right now around the province and other leaders are doing. That will be the leader of the party, and that's where that will be.
Our next questions are from Ross Lord with Global News. Please go ahead.
Dr. Fitzgerald, you mentioned complacency yesterday, and there was a reference just now. I'm wondering if you, and I know it's tricky with the moving target that every day brings, if you can help separate, if I can put it that way, the complacency from the fact that COVID-19 might be hiding behind symptoms that people might brush off as some other minor condition or because they're not feeling any ill effects at all. How would you characterize each of those factors?
So I think they both played a role. I think people felt that COVID wasn't here. We had been doing so well. We didn't have any. We didn't have to worry about it. So if you had sniffles, it couldn't have been COVID because we don't have COVID, right? I'm not faulting people for thinking that way. I'm not trying to say that they did anything wrong. I just think that it's what got us to where we are. I'm not judging anybody. It's just what's gotten us here and what we need to change so that we can get ourselves out of here. That's all. Complacency, I think, we have gotten a little bit complacent. I think we weren't wearing our masks as much as we should have. I mean, we saw that in our own department. It's human nature, and it happens. And again, we'd had such a good run with, so few cases. I think people just felt that, those travel restrictions, the isolation requirements when people came in made us immune, and it doesn't, and it didn't, and that's where, so we find ourselves where we are right now. But this is what can happen if we don't do those things and we don't really stick to those public health measures that we need to do and reduce our contacts as much as we can.
I guess my other question, and obviously most of the folks who are contracting COVID-19 are younger, and thankfully the symptoms are not debilitating. But for those who are most vulnerable, and this has come up here in the last hour or so, the long-term care homes, I might have missed it, but is there a percentage, even approximate percentage, of how many people in long-term care homes in Newfoundland and Labrador have been partially or fully vaccinated?
So I don't have the information with regard to all the RHAs. Specifically now in Eastern, we have, we've obviously been very cognizant of that over the last few days, but we have anyone who in long-term care who consented, who wished to have a COVID-19 vaccine, has had at least one vaccine. Some people have had two. Just recently, but certainly anyone in long-term care who wanted to have them has been vaccinated. Personal care homes and assisted living facilities are now our focus to make sure we get out and get those vaccinated as quickly as possible.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, and it's about testing. I'm noticing the numbers. We're rapidly ramping up the number of tests we're doing a day, but at the same time, there are still people who are sitting at home waiting for days, even if they don't have symptoms, but now have to isolate because of the risk that they were exposed. So first of all, how concerned are you about the delays we're seeing to get people tested? And the second part is what's being done to try and increase the capacity?
So certainly, we want people to get tested. The most important thing, though, is to isolate if you have an exposure or you're feeling unwell. That takes you out of circulation, and I guess COVID, if you have COVID, out of circulation, and that's the most important thing, right? With regard to testing, certainly we are looking at options right now to increase our capacity. We're looking at how we use our rapid testing in the most effective way to get us the information that we need.
Thanks. Kellyanne Roberts with NTV, do you have a final question?
I do. And Dr. Fitzgerald, I know you mentioned this at the very beginning of the briefing. Seeing a lot of questions of it on social media right now. In regards to the sports activities over the weekend, a lot of tournaments begin on Thursdays for school, so should we not be saying February 4th through to February 7th? And I guess just a bit of clarification around what those sports are. I'm seeing people ask if dance is included, or is it purely sporting events that happen at schools?
I would say any sporting event, and if you're asking the question, that the answer is yes. And so and with regard to the Thursday, I would imagine that most of those tournaments would have still gone over the weekend. So the teams that were playing on Thursday would have been playing on Friday as well. So I think we'll capture them regardless. So, so it would be any kind of sporting events or gatherings that you would have been at. So.
And just for those grades, right, the 7 to 12, not so much like an adult sport?
So we certainly, we have concerns in this age group is where we're seeing the most of that spread. And that's what Eastern Health is telling us, where they want to really clamp down on that. But so that's what's in the advisory, yes.
Thank you for the clarification.
Yes, you're welcome.
Sarah Smelly with the Canadian Press. Do you have a final question?
Yes, I know that there are a lot of them, but I'm just wondering in general how the young people are doing who've tested positive. Are their symptoms mostly mild? Are they hanging in there?
I think for the most part, what we've been finding is that they have mild symptoms, which is part of the reason why we're seeing so much spread, because they didn't really see their symptoms as being potential COVID symptoms.
Thank you.
Brian Callahan with VOCM. Do you have a final question?
Yes, please. Dr. Fitzgerald, we've talked about today about how some of these people just did not come forward, or there was reluctance or maybe complacency or even just reluctance not to get tested. And these cases more or less snuck up on us in that way for that reason. Are you concerned that, as we know, there are no walls, again, between the Avalon and the rest of the area, concerned that it has spread to the rest of the province? It could be in other communities outside central and in western Newfoundland, given the hockey teams and that sort of thing. And are you concerned that spread there? And, I have to ask, should the election be delayed elsewhere as a proactive measure before these cases crop up?
So that's always our concern, that there could be spread in those areas, and that's why we changed our symptom criteria so that you would get tested with one symptom. That's why I've been saying, that's why we suspended sporting events and gatherings, cultural, other arts and cultural extracurriculars and activities across the province yesterday. So certainly those are concerns for us. We're not seeing cases there just yet, but we know that COVID can spread, and when you find it in one area, you often find it in other areas. But if we all do what we need to do, then we can keep COVID at bay. And even if we do see some spread outside, we can certainly contain that spread. So following the public health measures, making sure that you keep your contacts low, all of that will certainly help if we see COVID in other areas.
Sure. Sorry, I know that someone's pointed out a contradiction that, you know, we've reduced these other activities to avoid the spread, but yet the election in other districts and throughout the island will go ahead. So, sorry, that was, anyway, I know I wasn't entitled to a follow-up there, but that's all I wanted to ask you about.
Peter Jackson with the Telegram, do you have a final question?
Just one. Dr. Fitzgerald, are you aware of a cluster of any sort in the Clarenville area?
I am not aware. That doesn't mean that, you know, Eastern Health is really the ones who are managing this, and they are the people who are on the ground who are really looking at all the cases and finding out where the cases are. So I would not necessarily know where every case is or where every cluster is. So if there are concerns in that regard or any questions in that regard, you know, we can certainly, I guess I'd need to know more what the concern is or where you're hearing that from, Peter.
Okay, thank you.
Elizabeth Witten with All Newfoundland and Labrador, do you have a final question?
Yes, I'm wondering how many separate clusters have emerged now?
So we have several unlinked chains of transmission, we call them. So as yet, we've not been able to make connections between several of these chains. And that is changing by the hour. So I really couldn't tell you how many clusters we have at the moment.
Thank you.
Patrick Butler with Radio Canada, do you have a final question?
Yes, please. Dr. Fitzgerald, so much of your communications with the public over the past few months has been about talking about how it's important to follow rules and things like that so that we avoid another lockdown. You know, given the huge increase in cases that we've seen in the past few days, is that where we're headed? You know, is another lockdown inevitable?
I'm not really sure how where we are right now in Metro is not the same. Like, we're pretty well locked down right now. So if you're talking about across the province, I mean, we hope that if we can keep, you know, if everybody can do what we need to do to keep the spread as low as it can, then hopefully we can avoid this situation anywhere else.
Roger Bill with iPolitics, do you have a final question?
I do. Dr. Fitzgerald, I don't want to ask you about the details of your conversation with Mr. Chalk, but I do want to ask you, do you think his decision was a prudent one? Was it a necessary one? Is it a decision that you support?
Mr. Chalk made his decision based on, I'm sure, quite a number of factors, and you know, it is what it is. So, you know, I think that we, if we can do the election this way, that's great, and I'm just going to leave it at that.
Thank you.
Ross Lord with Global News, do you have a final question?
Yeah, I wondered if there's any news. Sorry if I'm
Sorry,
Can't hear
we
you.
can't hear you
Sorry,
there,
can't
sir.
hear you.
Ross, we can't seem to hear you.
Oh, sorry about that. Can you hear me now?
Yep.
Oh, okay. Sorry. I wondered if there's any news today, and maybe I've missed it, about the possibility that any of these new cases is one of the newer variants.
So I mean, obviously we're always thinking about these new variants, and that's even a scarier proposition, but we certainly have been on the lookout. So we have sent away samples to be tested. We hope to have the results back by tomorrow.
Thank you.
Thank you, everyone. Premier, do you have any final comments today?
Well, thank you all for joining us today. My thoughts are with those directly impacted by COVID-19 and their families. Please stay safe, stay healthy, follow the advice, and we will get through this. We've got through other issues before. We will get through this one as well. So stay safe, be kind to each other, and remember, please follow public health advice and get a test if you have a symptom.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.